Hey, welcome to another video from SkinnyMedic. I want to talk to you about building your own trauma kit. Now you can buy trauma kits already put together, or you can build your own. So I want to talk to you about the components of building your own trauma kit. Now this kit that I'm going to talk about building is a true trauma kit. This isn't a boo-boo kit. This isn't for scrapes, minor wounds. So you're not going to see any band-aids or anything like that in it. This is for, oh my gosh, trauma, and it's going to fix it, and it could save your life. It could save a buddy's life. It could save a bystander's life. So the first thing we need to think about is putting this in a container or package. Now obviously you could go with just putting it in a plastic bag, seal it up, and this can go into a backpack, an everyday carry pack, whatever you want to. You can put this in there and it'll keep the components together and keep them dry. Or you could look at putting them into a pouch. Now there's a couple different configurations you can look at. So one of the things is a drop leg. I kind of like a drop leg, honestly, because you can, this attaches to your belt, this goes around your leg. When you kneel down, everything's there. So I kind of like a drop leg, but obviously you can't carry this everywhere. But there again, it's in a pouch, it's all together. You can still put this package here in your truck, your vehicle, and have it. When you take it out to range, set it next to your range bag. You can have it. You don't have to put it on your leg, but it's a fairly large package to store your IFAKs. Now you can also look at just put them in a pouch similar to this. I like the pouches that have the Velcro on the top that you can label them so that people know these are first aid kits. So two different configurations. Now I believe the single most important thing you're going to put in your trauma kit is a tourniquet. A lot of people are wearing body armor that protects us from here to here, so your arms are free, your legs are free. Those are most likely things that are going to get hit in an engagement. So a tourniquet is the number one important thing that you're going to carry in your trauma kit. There's different options on the market for these trauma kits. You pick and choose which one you like and which one you have personal preference on. There are quite a few commercial grade tourniquets on the market. You've got the Rat's tourniquet, Soft T, Cat tourniquet. Everyone has their preference on which tourniquet they like. Personally, I like the Cat. It's what I've used in the field, so it's what I like. But people swear by the Soft T, and you've got people that are swearing by these Rat's tourniquets. So you've got to pick and choose which tourniquet you want to. To me, the commercial grade tourniquets are faster to make than trying to improvise with a triangle bandage, a belt, things like that. But if you're on a budget, you can use these triangle bandages to make a tourniquet. Is it the best thing to use? No. But if you're on a budget, these are cheap. You can put these in your pouch, your bag, and make an improvised tourniquet out of this. But you can also use the commercial grade tourniquets, put them in there. If you're gonna start with your tourniquet, start out with one tourniquet, and then as you get the money, you get the resources, upgrade, buy another tourniquet, then buy another one, because you could honestly use multiple tourniquets on yourself or a bystander. So these are well worth their money. So the next thing we're going to look at is chest seals. Now there again, multiple companies making chest seals. You pick and choose. Everyone has their preference. I put a video on Instagram and Facebook, and everyone's had a different comment about which chest seal they prefer. You've got vented, non-vented, you've got different manufacturers, but you need to get a chest seal in your trauma kit. Preferably two chest seals, because if you get a high energy penetrating trauma to the chest, it can go in and out the back, and your lungs are on the back side as well, so you've got to seal that area as well. So when you put chest seals, you really need two chest seals at least in your kit. You can start out with something cheap like this, petroleum gauze occlusive dressing. This is cheap. You can tape it on and it's there. If you want to go with a more commercial grade chest seal, then you got like the Halo. This is the Ashman chest seal, and you have the Hyphen chest seals. There's others on the market. There's multiple companies out there making ones even I don't have here mentioned, but you need at least two. Put them in your trauma kit. So number one thing when we're talking about trauma is stop the bleeding. Obviously that's important because you can't replace red blood cells, which is carrying oxygen. So you've got to stop the bleeding. So we have our tourniquet mentioned, and then now we're going to talk about gauze. We can do hemostatic agents as well. So we have combat gauze, Celox. There's a few others on the market as well. And you have non-hemostatic agent gauze. These are just regular bandages here. So I kind of like both because you can have 5x9s, things like that absorb really good. And then the hemostatic agent gauze here. So combat gauze, Celox have hemostatic agents that are going to help the clotting process, help the bleeding. There again, this is personal preference. Everyone says, oh, I like combat gauze, oh, I like Celox. Both have their advantages, both have their disadvantages. So pick one and use it. So put this in your pack. Probably at least one, maybe a couple of these if you can afford it. If you've got the resources to buy multiple packs of this, go ahead and do it and stick it in your pack. If you don't, at least buy one. You can, of course, we're using this for wound packing, get this to the source of the bleeding, and then backfill it with just the regular gauze. So you've got the 5x9s here. These work really well. They're very absorbent for controlling bleeding. H&H gauze, some kind of like that cheesecloth is basically, it's a sterile cheesecloth for wound packing. It works really well. So you could use this in combination with like the combat gauze, the Celox. Use those first and then backfill with this type of gauze. Also, I've seen people use cling. This works okay. The problem with using cling, it does have a disadvantage, is when you go to clean the wound out. Those little bitty fibers get stuck in the wound, and man, they're a pain to clean. So, but you can use these. These are unroll, pack them into the wound, hold pressure, and then this will work. I do like keeping a pair of gloves in my kit because I may have cuts, may have scrapes on my hands, and I don't want the exposure. So you'll see people wear black, blue. There's no difference. These are non-latex, so, and there's no difference in the quality of gloves here. Some people don't like the black because if you're in an obscure environment and I'm waving my hands, I'm moving, you're more likely to see this blue or the orange or purple, whatever gloves you're wearing. So people are more likely to see it. So people wear black gloves so when they're working on a patient, if they're still an active shooter, they're still a shooter looking to take down that person, then you're more likely to be less seen wearing black gloves. The problem with black gloves is they're harder to see blood, so you kind of have to more work with feel. Now, if you've ever felt blood in your gloves, you know what it feels like. So I can feel the difference, honestly, if I'm working on someone, even in the ambulance, between sweat, between water and blood. You can feel the texture difference. So that's the difference. Here, you've got the blue gloves. You can see the blood on your hands. If you're doing like a rapid exam, you're going to be able to see blood. I've got blood on the back side. You put gloves out, you can see the blood. Here, it's going to be more by feel. So you can still see blood on your gloves here. It's just a little more difficult. Another item you can keep in your trauma kit is an MPA. Now, they figured out that a number 28 is the average size person. So I put a number 28 in my trauma kits. So this is going to hold someone's airway open that is not able to maintain their airway. It means they're unconscious, not responding, and their airway is not protected. So you can put this in their nose, and this is going to hold their airway open so you don't have to maintain it. You can do other things. So it's a good idea to slip it in there. If someone's obtunded enough that they can't protect their airway, you can put an MPA in their nose. And you don't have to worry about like a gag reflex, anything like that. Having a good pair of scissors is important as well because if you can't find the wound, you can't treat it. So if you can put a pair of scissors in your kit, that way you can cut clothing, expose the wound, cut up the shirt, cut up the pants, so you can see the wound, see the major trauma, then you can be able to treat it. So putting a pair of scissors in your kit is very important. So one of the things that happens when you have major trauma is your patient goes into shock. It means all the blood gets pulled out of the arms and legs and goes into the core because the brain wants to keep this core area alive. So we can put a Mylar blanket that's going to protect the patient's body heat, and it's going to help them in their situation of going into shock. So one of the things I like keeping in the kit is a flashlight, chem light, things like that, because you may be in a dark situation where you can't see very well, and if you can't see the wound, you can't fix it. So having a chem light is important. This is going to let off just enough light that we can see what's going on with our patient. Now, if you have a flashlight, obviously, you can use that as well. So, but having some sort of light, that way if it is dark, you're in a dark environment, you can see what's wrong with your patient. Looks like I have a lightsaber. It's pretty cool. I like having tape in my kit as well, whether this be duct tape or you have medical tape, but get some good quality tape. Don't buy the cheap clear tape if you're going to buy medical tape. Buy the cloth tape. I like cloth tape. I like duct tape. So having this in your kit, but you may not have the size for this, so whole roll. So you could tear it, make the little fold like people do, just to have a little bit of duct tape in here to kind of help bandaging, tape bandages on, things like that. So having some tape, whether it be duct tape or good medical tape, is another good item to have. So one of the things people always bring up is about pleural decompression needles. These are made for treating someone who has a tension pneumothorax or a hemothorax, meaning air or blood is in this chest cavity here, and they're going into shock because of it. So people always ask me about these pleural decompression needles, and I say that if you have the training for it and you can get them, fine. If you don't have the training for it and you don't know how to use it, you can kill someone with this. So I don't like it. So, but it's always out there. So you can pick these up, Amazon, eBay, you can pick these up. So what it does is pressure starts building up in the chest cavity. You stick this needle over top of the rib cage. It penetrates the pleural space, and blood and air is supposed to be relieved out of here. So if you're doing on this side, they have decreased breath sounds over here. It's not so big a deal. There's only a lung here. So, but over here, you miss, and the heart's right there. You just put this needle in the patient's heart, and that's a bad idea. So if you want this, put it in your kit. You know, it's one of those things that's controversial. Everyone talks about whether or not you should have one or don't have one, but this is the information. I'm just providing it to you. So I hope this video helped. I hope it gave you some ideas on building your own trauma kit. If you want to go to my website, shop.SkinnyMedic.com, I have all the supplies to build your own trauma kit. I also have trauma kits already pre-made. You can buy them with combat gauze or cell locks, and they're already pre-made, pre-packaged, ready to go for you. So check out my website, shop.SkinnyMedic.com. I appreciate you guys. Thank you for all the support. You never know when you're going to be the first responder. Remember, you need the right gear and the right training. As well, so multiple examples of chest seals, but you need at least 2 in your tourniquet. So these have a clotting agent in them. I'm flicking you off. Oops, my bad. While we're talking about controlling major bleeding, then you can do the 5x9s here. So these work really good. You can put these on the wound, hold pressure. Oops. I do always like to keep a pair of gloves in my kit, basically for